Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and here is the update on the COVID-19 situation as of October 7th. We now have 8,083 confirmed cases in Sonoma County, an increase of 46 cases in the previous 24 hours. Those include 1,549 active cases and 6,408 people who have recovered. We have had 4 more deaths reported in the last 24 hours, so the total now stands at 126. We have done nearly 185,000 coronavirus tests so far. Based on this week's numbers, Sonoma County remains in the purple tier of California's blueprint for a safer economy. This is the most restrictive level and is based on 2 main metrics: new daily cases per 100,000 population and test positivity rate. We have an adjusted new daily case rate of 10.8. We need to be under the benchmark of 7 in order to move into a less restrictive tier. We have a test positivity rate of 5%, which is below the benchmark of 8% and would move us into the next tier. Many things about the coronavirus are unclear, but one thing is certain: COVID-19 causes disproportionate harm to communities of color and those in the lower socioeconomic status. To address this, the state has implemented a new health equity metric in California's blueprint for a safer economy for counties with populations greater than 106,000 people. Therefore, Sonoma County must show that it meets test positivity goals for the most impacted communities and has invested resources in targeted testing, contact tracing, and education specifically to do this. We welcome the addition of this new metric since it aligns with our focus on equity and addressing health disparities. We plan to continue targeted testing, case finding, bilingual, bicultural outreach in the most vulnerable sectors of our county's population. This outreach includes our partnership with a nonprofit group, On the Move, which will use its successful program, La Plaza, to develop and implement a large-scale COVID-19 outreach and education campaign targeted at Latinx and Indigenous communities. Our targeted efforts have already dramatically decreased the disparity. And though the latest equity metric test positivity rate is now at 8.1%, just beyond the benchmark of 8 required to move into the red tier, we feel that this metric is going to help us move in the right direction by ensuring our county is ready for the increased interactions that occur when we go to less restrictive activities. There's also an accelerated progression provision in the equity metric in which we can move to the red tier by lowering our test positivity rate for our most impacted communities, enough to bypass the new daily case benchmark. That's the case rate benchmark of 8. As we work our way through this challenge, it's important to remember that we're all working together to get Sonoma County back to school and work. This can only be done if all of us take responsibility for protecting those most at risk, our healthcare workers, and those working in the front lines. Thank you. Now I would like to share my screen and present some slides for you to better understand where we are in terms of the blueprint for a safer economy and how we compare with some other counties that are neighboring and also ones that are a little more distant. Let's see if I can get, oh, there we go. Okay. So I'm going to talk a little bit more about the health equity measure and then go through some of the data and what might be driving our cases. So the health equity measure was introduced as a component of this blueprint to a safer economy tier system. So the whole point is just to reduce disease transmission everywhere in the county, and especially in those communities that are heavily impacted by COVID, so that we can reopen the economy safely. And it's based really on the tenet that everyone deserves the opportunity to live a healthy life. This metric looks at test positivity of people who have the fewest resources, as defined by looking at the bottom quartile. That's a bottom 1/4 of census tracts in the Healthy Places Index for our county. So the Healthy Places Index is something that's been used quite widely. It's a validated measure. And all it does is provide a composite score by census tract of socioeconomic indicators related to health and life expectancy. I'm not going to go over this in great detail. You can find it on the state's website. So each county would be required to submit a plan to the state for how they will disproportionately invest resources in reducing disease transmission in this most impacted sector of the population. The targeted investments can include spending on testing, disease investigation, contact tracing, isolation, quarantine, and education and outreach efforts for workers. And the state will provide technical assistance for these investments. It's a collaborative process. You can find these suggested activities in the state also on the state CDPH website about the health equity metric. So how will this impact tier placement, the new metric that is? As you can see, counties with the current tier status of being widespread, that's tier 1, the purple tier, are eligible to enter the next tier based on case rate and test positivity, as we already discussed, but they must also meet this test positivity for the bottom quarter of the census tracts. In other words, a lowest socioeconomic status in our county of less than or equal to 8% test positivity. And it would have to be less than 5.2% to go into the orange and less than 2.1% to go into the yellow tiers. However, this measure supports reopening in a different way. We're in purple, and if we meet the test positivity countywide and for that bottom quartile in the Healthy Places Index in our county, then we can go to the red tier even if our case rate is still above 7 cases per 100,000 per day. So this gives us a chance to move to the red tier by showing that we're really impacting test positivity in that lower quartile and in the entire county, even if our case rate doesn't meet going into red. So this is going to help us as we move forward. Right now, as I noted, we have a case rate of 10.8 per 100,000 daily, but our positivity rate is at 5% right now overall, and that does meet the red tier. So we need to work on getting that positivity rate under 8% in that lowest quartile of the county and show that our case rate is also declining. It may not meet the under 7, but if we can show it's declining and get our test positivity rate in the lowest quartile under 8%, we can move to red. Quickly comparing us with the other counties in the North Bay, you can see here Sonoma, we did hit this very low point of 7.8 cases per day per 100,000 a couple of weeks ago, but we've crept up some more, and we're going to look at that here shortly. Mendocino is along with us. You can see Solano and Napa and Marin, and they are lower than us at this time and in the red tier. If you take a look at us compared to Contra Costa, Alameda, San Francisco, they've been pretty much stable, but lower than us as well. And Contra Costa just went into the red tier recently because they went under 7 for a case rate. And then if you look at San Mateo, Santa Clara, Santa Cruz, and Monterey, Monterey is quite a bit like us. As you can see, they have a higher case rate than us, and we're about the same right now. So anyways, these other counties are lower than us, and we're going to take a look at the data a little further. As far as testing volume and how much testing we're doing, we're doing fairly well. We're along the average in terms of the other counties. You can see San Francisco is testing double though. They're able to achieve a testing volume of 530 tests per 100,000 population. So we can improve our testing and scale that up, and that will help us because our case rate is multiplied by an adjustment factor. If we're testing at the level that San Francisco is, we could actually multiply our case rate by 0.6, and that would put us into the red tier. That's another strategy. So let's look at regional approaches to reopening and how they may have impacted how different counties are doing. Counties that relax the local restrictions to align with the state prior to us include Napa, Solano, Monterey, and Santa Cruz. Counties that relax the local restrictions to align with the state in late June is where we fall. Sonoma and Mendocino is also in the purple, and San Mateo and Contra Costa that just went into the red. There are counties in the Bay Area that have consistently been more restrictive than the statewide order in higher risk activities. San Francisco, Santa Clara, Alameda, and Marin, and some of these are actually moving into the orange, as you can see. So how have they been more restrictive? Here's some examples. San Francisco and Santa Clara limit the restaurant table size to 6 people. And I know that in Contra Costa, and I believe Alameda and Santa Clara as well, they also restrict the time that a party can be at the restaurant to less than 2 hours. Santa Clara and Marin limit funeral and wedding attendance. San Francisco prohibits indoor nail and hair salon and barbershop activities. And San Francisco also limits outdoor gym activity to 12 people. And Marin and Alameda just very recently opened hotels and short-term rentals. So if you take our COVID-19 cases by episode week, you can see that we are really high in terms of cases somewhere around early to mid-August, and we've been declining. So we were doing quite well and have recently seen this spike in our cases in the weeks of September 13th and 20th. And we'll look at that some more. We have to be under this red line to get into the tier 2 or red. And this slide simply shows that this increase is for most of the age categories across the board. And you can also see that Santa Rosa is where most of our cases occur, and it's also where we've had a big increase as well, but different cities have also been affected by the increase. So let's take a little closer look at Santa Rosa. The vast majority of cases seen in Santa Rosa are seen in Santa Rosa, and the previous downward trend has stopped and kind of leveled off. This here is Santa Rosa, not Windsor. This is Windsor down here. So Santa Rosa is really where we're seeing that case increase. And the rates are remaining steady or decreasing in other cities of interest. The zip codes that have been impacted the most in Santa Rosa are the following: 95401, 95403, and 95407. And they saw the highest peak rates in Santa Rosa, as you can see from the graph here. 95409 is also seeing a slight upward trend. And if you take a little closer look in these zip codes, it is actually the Hispanic population that is being most affected. If you take a look, especially at the 95407 zip code, and that's where we need to focus our efforts. Again, we are seeing in people who self-describe as Hispanic Latino, the greatest numbers of cases, as you can see here, compared to other races and ethnicities. Interestingly enough, we've had more cases in the last couple of weeks from OptumServe. And as all of you out there know, OptumServe is providing tests, state-run service for anybody and everybody who wants to be tested. So this could indicate that we're having more community transmission. Public health has always tested contacts. We've had a slight increase. The clinics have also tested different types of people, contacts and non-contacts. And they saw a little spike in the week of September 20th, but then have gone back down the week of September 27th. And Kaiser also has had this slight modest increase in the last couple of weeks. But I really think this OptumServe data shows that there might be a little more community transmission happening. You look at the places where the exposure is occurring in our cases, it's still largely household exposure, but you can see workplace congregate settings are down. That's our skilled nursing facilities and our residential care facilities. But this, I want to highlight large and small gatherings, as defined as large gatherings are more than or equal to 12, small gatherings of less than 12, are where we are actually seeing a lot of exposures. This is a success story, I believe. We've had a huge decline in our cases occurring in skilled nursing facilities and residential care facilities for the elderly. And as you know, if you've been following along, we have put a lot of effort into getting infection control practices appropriate in these facilities, having them cohort patients really well, and sort of being more involved in when patients are transferred to and from these facilities and aiding the facilities through their outbreaks. And the state has been great in helping us with that. And it's been effective. Look at the decrease we've seen in cases in these facilities, in staff and in residents. Looking at gatherings since September 1st, since Labor Day, 99 gatherings have been associated with case transmission. 56 were large gatherings, 43 were small. And the most important or common reason for gatherings were informal gatherings with friends and families. And as I've always said, it's really best for us to stick with our households. And even when it comes to extended family and friends and neighbors. Funerals, memorials also were implicated in 13 such situations, birthday parties for 12, Labor Day celebrations. They were a little hard to elicit from people who are cases, but definitely associated. And this is a right timing for us to have increase in cases from Labor Day celebrations. It's been about 4 weeks, which is my estimate of probably the time that it takes to really see an impact of everything. House and work parties, religious services, the inequities still remain. This just shows household income by case rate. This is a statewide graph showing that there are much higher case rates in the lower socioeconomic groups. And that's essential workers, people who are living on limited incomes, maybe don't have sick leave and benefits, no job security, et cetera, et cetera. COVID-19 has definitely had an impact on communities with the access to the fewest resources. This is the Hispanic group here, and this is the non-Latino, non-Latinx group here. And that just highlights this again. So how are other counties addressing equity, and what could we look at as models? Santa Cruz and Solano offer low-income residents rental assistance. San Francisco, Alameda, and San Diego have programs to give stipends for those who have to isolate. Alameda, I believe, is giving $1,200 for those who meet criteria and are eligible, who are cases, so that they can isolate or quarantine. We, of course, are doing a lot to address equity as well. The targeted pop-up testing, outreach, and messaging, as I mentioned, On the Move has been contracted to provide a lot of this, and we'll be performing a lot more of this outreach starting next week. We have bilingual contact tracers, the Latinx Health Work Group, and we've also, as I mentioned, this is the Urgent Respond and Aid project through On the Move, and you'll be seeing this large-scale outreach soon in our community. Many areas of need still remain, with the economic toll of the pandemic making it harder for low-wage employees to miss work and take health precautions. So much more needs to be done to address the root equity issues that are driving these health disparities. We need further funding. We need to support our essential workers with wage replacement, job security, food, nutrition, and culturally appropriate spaces for quarantine or isolation, more outreach and engagement, more education to employers to protect employee health. The areas where we're seeing workplace transmission are still, as we've said before, agriculture, construction, healthcare, sales and service, and some unknown workplaces as well. And the types of work are caregiving, food protection, healthcare, public safety. Again, we've always presented that over half our cases are developed through close contact. So again, it's really important to get people who are infectious, who are cases, potentially out of the household. So we could reduce the transmission in workplaces and other sectors, quickly interview, isolate, and quarantine cases and contacts, and increase the utilization of the alternate care site. There have agriculture and farm work has always been an area that has had a lot of cases, and we need to work more with these sectors to get those case rates down. Tourism is hard to show because we don't get data on cases that don't live here in our county, but crowds have been observed. There's been increases following holidays such as Labor Day of cases, and we need to increase our mitigation strategies in this area. We've also had cases in evacuees. About 30 some people noted that they did evacuate during the fires. These are people who are positive for COVID, and at least 14 were exposed. We know that they've had exposures and became cases during the Walbridge-Myers fire evacuation. It's too early to see the impact of the glass fire evacuation. I have presented data on the schools before, so I'm not going to go into this in great detail, but we have definitely had cases in schools, even with distance learning. We do now have 25 cases identified among persons experiencing homelessness with a recent uptick. And this is a very difficult population for us to ensure that we limit transmission in. We've seen cases in those who are incarcerated as well, and need to have good screening procedures in place and contact tracing procedures. So in summary, multiple factors lead to what we're seeing. And we have a lot of work to do. We have to address in a multi-pronged way, many different sectors and many different factors that contribute to our increased case rates as we move forward. So I'm going to stop sharing there, and thank you very much.